Good afternoon. My name is Stacy Wood, and today's date is May 13th, and this 14th. Excuse me. I'm a public information officer here in the Emergency Operations Center. Today's updates are being aired live on Buncombe County Government's Facebook page and are also available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's updates come from Dr. Mullendor, Buncombe County Interim Public Health Director and Medical Director, and we'll get started.
Good afternoon. Despite facilities' robust efforts to prevent the transmission of COVID-19 among staff and residents, outbreaks in long-term care facilities continue to occur throughout North Carolina and the United States. Cases associated with long-term care facilities make up half of the cases of COVID-19 in North Carolina. Yesterday, we reported that Buncombe County have been notified of outbreaks of COVID-19 in 2 long-term care facilities within our county. An outbreak of COVID-19 in a long-term care facility means that they have at least 2 lab-confirmed cases in staff or residents. Buncombe County Public Health is actively conducting contact tracing and coordinating with these facilities, assisting them with testing of their residents and staff, reviewing infection control measures, and providing links to other needs they may have. We have directed these facilities to perform testing in all residents and all staff, regardless of symptoms. This testing will be repeated on a schedule that includes 3 days after initial testing and weekly thereafter until no further cases are identified. Guidance on testing in long-term care facilities is still under review at the state level, and so our guidance is subject to change. We believe that there will be more outbreaks in congregate care settings in our county. And our Buncombe County Emergency Operations Center anticipated outbreaks in these long-term care facilities many months ago at the start of the pandemic. Fire marshals and environmental health specialists jointly visited every long-term care facility in Buncombe County in early April to assess facilities' prevention strategies and to create a line of communication in the event of a COVID-19 outbreak. Currently, we are working on creating a strike team that will visit all congregate care facilities in Buncombe County to ensure that administrators have the support and guidance they need. As medical providers and facilities continue to test for COVID-19, this strike team, which will be made up of public health nurses and emergency services personnel, will provide education on personal protective equipment and review site plan layouts and plans for isolation and quarantine of suspected or known cases. And they will also provide facilities with a list and link to providers who are able to do testing of their residents and staff, help them obtain the supplies they need, such as personal protective equipment, and provide technical assistance when it comes to testing of staff members and residents. Information on case counts in congregate living facilities can be found on the North Carolina Department of Health and Human Services website. This report is updated every Tuesday and Friday at 4 p.m. At this time, over 3,500 COVID-19 tests have been performed on Buncombe County residents. And as of noon today, we have identified 116 cases of lab-confirmed COVID in Buncombe County. Almost 46% of these cases are in individuals between the ages of 25 and 49. There are still 4 COVID-associated deaths in Buncombe County. And to clarify something that was mentioned by Dr. Hathaway from Mission on our Monday media briefing, the numbers he reported included people who were not residents of Buncombe County. We have to remember that Mission Health serves people from all Western counties, and in our case count and fatality count, we are counting Buncombe County residents. In Buncombe County, just over 34% of our lab-confirmed COVID-19 cases are in the Hispanic or Latinx population. And we know that in Buncombe County, approximately 6% of our population identifies as Hispanic or Latinx. So this disproportionality is not to be taken lightly. The data tells us that in the United States, only 16% of Hispanics or Latinx individuals and 20% of African Americans are able to work from home. And they are more frequently, working in jobs where physical distancing is not possible. And this comes from data from the United States Bureau of Labor Statistics. As COVID-19 has highlighted health and social inequities across the country that existed prior to this pandemic, we now have a window to set a path that prioritizes better health for all. We have and will continue to conduct outreach to our Hispanic, Latinx, African American, and other under-resourced communities to ensure that we are offering testing in those communities to meet the needs of that community by removing financial and physical access barriers to testing. And we encourage anyone who has symptoms of COVID-19 to get tested. To that end, the Buncombe County Emergency Operations Center's Rapid Response and Recovery Equity Action Team has identified testing site locations based on an equity analysis that relies on relevant data and community input. Western North Carolina Community Health Services is providing testing in locations throughout Buncombe County. Testing is available to both the insured and uninsured with no out-of-pocket cost. Those with health insurance are requested to bring their insurance information with them to the testing site. And language access services are available at these sites during their hours of operation. The symptoms of COVID-19 include cough, shortness of breath or difficulty breathing, fever, chills, repeated shaking with chills, muscle pain, headache, and a new loss of taste or smell. If you have these symptoms and you have transportation, please reach out by calling ahead first to one of the facilities that is providing testing. We have Mayheck Family Health Center at Biltmore, the 4 Mercy Urgent Care sites, and Range Urgent Care. The community testing sites are designed as walk-up sites for members of that community and for those who are unable to get to an urgent care or primary care provider. Our first community testing site earlier this week, we had 46 people tested at Hillcrest on Tuesday, and testing is currently underway at the Buncombe County Schools Central Office. Next week, Western North Carolina Community Health Services, in conjunction with the county, will run COVID-19 community testing sites in the Pisgah View community on Tuesday, May 19th, from 1 to 4 p.m. We will be at the Sandy Mush Community Center on Wednesday, May 20th, from 1 to 4 p.m. And in the Deaverview community on Thursday, May 21st, from 1 to 4 p.m. And we will continue to hold and host these testing sites throughout our community in the coming weeks. More details about testing can be found at the buncombeready.org website. I want to be clear, there are enough testing supplies available for members of our community who have symptoms of COVID-19 to be tested, both through medical providers in their offices and through our community testing sites. At this time, the guidance from the North Carolina Department of Health and Human Services is not to test people who are asymptomatic except in certain circumstances, like long-term care facility outbreaks, or if they are close contacts to a case in some situations. Please continue to use caution over the weekend. Stay away from those outside of your immediate household to the best of your ability. COVID-19 is still here. It hasn't gone away, and we are all still at risk. When you are out in public, wear your cloth face covering. Keep washing your hands and disinfecting frequently touched surfaces. Keep yourself safe, your family members safe, your friends safe, and our entire community safe. Our success in making it through this outbreak is dependent on each of us playing our part. And so I ask you to do your part. Thank you.
That concludes the May 14th community update. Thank you for staying engaged, and I encourage you to share accurate information about COVID-19. And the source for the most accurate information on the COVID-19 response in Buncombe County is the Buncombe County government webpage. And that web address is www.buncombeready.org. Thank you for tuning in, and we'll be back Monday with a community update.